Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number first. Coagulative necrosis of the myocardium in calf is seen in option A, rinderpest, options B, necrophorus infections, option C, both A and B, or option D, mycoplasmal infections. The right answer is option D, that is mycoplasmal infections. Coagulative necrosis of the myocardium in calf is seen in mycoplasmal infections. Let's see some lesions which is especially seen in mycoplasmal infections. That is sharply circumferenced nodules that is scattered throughout the affected lungs. Similarly, we can see that marvelings of lungs, hemorrhagic infractions, which is leading to that necrosis in different organs like lungs, liver, spleen, kidney, heart, pericardium, and joint. And if we see that lesions which is seen in rinderpest, that is jabra marking or tiger strappings in large intestine. And if we see that the lesions which is seen in a foot rot, that is Asperophorus, necrophorus infections, that is ulcerative changes seen in interdigital space. Question number 2. Ulcerative lymphangitis is caused by option A, virus, options B, parasites, option C, bacteria, options D, none. The right answer is option C, that is bacteria. Ulcerative lymphangitis, also known as caseous lymphadenitis, is an infectious disease of cattle and horse. It is mainly characterized by formation of a skin ulcer with involvement of lymph vessels of lower limbs, and it is mainly caused by Corynebacterium pseudotuberculosis, which is a spores forming a non-capsulated gram-positive bacteria. Okay. Question number 3. Strangle in horse is caused by option A, virus, options B, bacteria, option C, protozoa, options D, prion. The right answer is option B, that is bacteria. Strangles, which is also known as equine distemper or infectious adenitis, is an acute infectious disease of equine. It is mainly characterized by there is a catarrhal inflammations of the upper respiratory tract with suppurations and abscess formations of that associated lymph nodes. And this strangle is mainly caused by Streptococcus equi, which is a gram-positive bacteria, and is mainly affect young horse within age month of 6 month to 36 month. And if we see that specific lesions which is seen in strangle, that is edema and congestions of that nasal mucous membrane, and there is a abscess formations in pharyngeal and submaxillary lymph node, and empyema of that guttural pouch, and there's a suppurative pneumatic changes seen in lungs, and there is also changes in pleura and pericardium too. Okay. Questions number 4. Turkey egg appearance of kidney is important features of dash disease of swine. Option A, swine fever. Options B, Glasser's disease. Option C, both A and B. Options D, African swine. The right answer is option A, that is swine fever. Swine fever, let's see that pathognomic lesions of swine fever, that is button ulcers seen in that cecum and colon. Button ulcer is like ulcers which is in a shape of button, is mainly seen in cecum and colon, and there's an appearance, kidney appears as like a turkey egg shape, and the spleen is totally infracted. Okay. And let's see some other facts of swine fever. This swine fever is acute, that is short time acting and highly contagious viral disease affecting pig of all age. It is mainly characterized by rapid and sudden onset and high morbidity and mortality with a generalized hemorrhage. That morbidity refer that the out of total number of that susceptible animals, how many of that get that infections gives by morbidity, while that out of that infected one, how many of die, that is given by mortality. Okay. And swine fever is caused by an enveloped single stranded RNA virus, that is pestivirus of family Flavivirides. Okay. Question number 5. An immune reactions against a self-antigen is called option A, autoimmunity, options B, immunodeficiency, option C, innate immunity, or option D, acquired immunity. The right answer is option A, that is autoimmunity. Autoimmunity is the system of immune response of an organism against its own healthy cells, tissue, and other body normal constituents. Any disease resulting from this types of immune response is termed as autoimmune disease. Since when the body produces antibody against its own body cells, when the body is unable to differentiate between their own and that foreign antigens, such type condition is known as autoimmunity or autoimmune disease. And immunity deficiency is just simply the lack of immunity, that is lack of ability to fight with infections. Okay, and this immunities are of two types, that is innate immunities and acquired immunity. Innate immunity is that the immunity that individual which is born with such type of immunity is known as innate immunity. This innate immunities last for whole life, and these innate immunities are of three types, like species, certain species is immune against certain diseases, certain breed is immune against certain diseases, or it is individual, certain individual is immune against certain uh, diseases, and such type of immunity is known as that innate immunity. While acquired immunity is that immunity that persons acquired during their lifetime, either by mean of passive immunity they get by mean that colostrums of mothers, and active immunity they gain by means of vaccinations extra. Questions number 6. Joni disease in bovine is caused by which of the following? Options A. Mycobacterium bovis. Options B. Mycobacterium tuberculosis. Option C. Mycobacterium intracellular. Options D. Mycobacterium paratuberculosis. The right answer is option D, that is Mycobacterium paratuberculosis. Joni disease is a chronic infectious fatal gastrointestinal disease of ruminant. It is mainly characterized by progressive emaciations and diarrhea. It is mainly caused by Mycobacterium paratuberculosis or Mycobacterium joni. And if we see that specific lesions, then thickened and corrugated intestinal wall is seen. And the diagnosis of that joni disease is intradermal or intravenous Joni test. Okay. Question number 7. Acute theileriosis is caused by which? Option A. Theileria annulata. Options B. Theileria mutan. Option C. Theileria parva. Or option D. All. The right answer is option A, that is Theileria annulata. Theileriosis, also known as East Coast fever, red water, rhodesian tick fever. It's a protozoan disease of exotic and crossbreed cattle, mainly characterized by high fever, anemia, and that swelling of that lymph node. And if we see that causes of theileriosis are that Theileria annulata, Theileria parva, Theileria mutans. And this Theileria annulata is the most extensively distributed parasites and is caused tropical and acute theileriosis. And this parasites remain in a body in a two form, that is erythrocytic forms, and second is a Sijons form. Sijons form is presence in lymphocytes, and the Sijons in lymphocytes, that is known as that coach blue bodies. Okay. And if we say that pathognomic lesions of theileriosis, that is a we found that punched necrotic ulcer in that abomasum, which is the pathognomic lesions of this theileriosis. Okay. Question number 8. Babes nodules in the rabies is formed due to the collection of option A. Astrocytes, options B. Oligodendroglial, option C. Microglial, options D. Ependymal cells. The right answer is option C, that is microglial cells. Babes nodules in the rabies is formed due to the collections of microglial cells. If we the microscopic lesions of rabies, and then we found there's a negri bodies and there's a Babes nodules. Negri bodies is actually the accumulations of large aggregate of dense granular viroplasms in the cytoplasm of infected cells. And these negri bodies are found in hippocampus in case of a carnivorous animal, and Purkinje cells of herbivorous. And second is that Babes nodules. Babes nodules are discrete glial cells clusters, which is resulting from that cells proliferations. Okay. Questions number 9. Abortions in last trimester in cattle is caused by option A. Brucella infections, options B. Vibrio infections, option C. Trichomonas infections, option D. All. The right answer is options A, that is Brucella infections. If we see that abortions causing bacteria along with that stage of pregnancy at which abortions occurs, Then Brucella abortus cause the abortions at last trimester of a pregnancy, while Trichomonas infections cause abortions at first trimester of a pregnancy, while Leptospira infections cause that abortion at last half of trimesters of pregnancy. Listeria also cause that last trimester of a pregnancy, and viveriosis cause that abortion at about 5 to 6 months of a pregnancy. And while mycotic, that fungus infections cause abortions at 2 to 7 months of pregnancy. Okay. Question number 10. Mixed granulomatous inflammations does not occurs in option A, actinobacillosis, options B, actinomycosis, option C, aspergillosis, options D, tuberculosis. The right answer is option C, that is aspergillosis. Mixed granulomatous inflammations occurs in actinobacillosis, actinomycosis, and tuberculosis except aspergillosis. If we see that granulomas, there are various types of granulomas, that is epithelioids granulomas, epithelioids with suppurations, and histiocytic granulomas, foreign bodies granulomas, and mixed type granulomas. Since that in case of TB and fungal infections, we found that epithelioids granulomas, and similarly epithelioids with the suppurations also seen in case of TB and fungal infections. Histiocytic granulomas found in fungal infections and parasitic infestations case. Foreign body granulomas seen in case of foreign bodies infestations, and mixed types granuloma is seen in case of TB and parasitic infestations. Okay. Questions number 11. Pulluram disease in poultry is caused by option A, Salmonella, options B, Mycoplasma, option C, Leptospira, options D, Mycobacterium. The right answer is option A, that is Salmonella. Pulluram disease in poultry is actually caused by Salmonella pulluram. This pulluram disease is also known as bacillary white diarrhea. Is a contagious egg transmitted disease, mainly characterized by white diarrhea in case of young chick, and mainly a chick below 3 weeks of age are highly susceptible to this pulluram disease. And the most important method of spread of disease is from that infected hen through that egg to the newly hatched chick. Older bird may appear depressed and have pale and shrunken comb with ruffled feathers, and both growing and older bird may show that greenish brown diarrhea in case of that pulluram infections. Okay. Questions number 12. In avian pox, boral bodies are present in dash body. Options A, Russells. Options B, Bollinger. Option C, Councilman. Options D, none. The right answer is option B, that is Bollinger. Bollinger bodies are actually observed in infected tissue of bird with avian pox. Bollinger bodies are relatively large, granular, acidophilic, intracytoplasmic inclusion body, which is seen in avian pox infected cells. If we see that the respective inclusions bodies of a certain diseases, and in case of that avian pox, that Bollinger bodies, the inclusion bodies not termed as Bollinger bodies. In case of cowpox, that is guanary bodies. In case of small pox or vaccinia, that is Pastian bodies. Herpes virus infection, that is cow dry bodies. Borna disease, that is Joset's body. Aggregate of ribosomes and neutrophils is known as Joel's bodies. In case of theileriosis, that is Scotch blue bodies is found. In case of multiple myeloma, that is Russell's bodies. In case of yellow fever in men, that is councilman bodies. Questions number 13. Hazari disease in poultry is caused by options A, rickettsia, options B, bacteria, option C, E. coli, options D, virus. The right answer is option B, that is bacteria. The right answer is that is E. coli. Hazari disease in poultry is mainly caused by E. coli infections. Colibacillosis, which is termed as that E. coli infections in poultry, it mainly occurs in two forms. That is systemic infections, and there is a localized infections. Systemic infections, that is presence of E. coli in that blood and affect that whole systems. Uh, Blood circulation, that is termed as choleseptemia, respiratory tract infections, pericarditis, osteoarthritis, and synovitis, polygranuloma extra. And if we say that localized infection, then in this infection is restricted to specific or limited area. Localized infections of E. coli includes omphalitis, which is yolk sac infections, salpingitis, which is inflammations of uterus and peritonitis in layers, enteritis, which is inflammations of intestine, coliform cellulitis, which is that the inflammations of subcut tissue, Solon had syndrome, and egg peritonitis extra. Questions number 14. Favors in a fungal disease caused by option A trichophyton, options B microsporum, option C both, options D none. The right answer is option C, that is both above. Fabus or tinea fabosa is a severe and chronic inflammatory dermatophyte infections which is mainly caused by both trichophyton and microsporum fungus. Okay. Question number 15. Hemorrhage at the tips of proventricular gland is a features of dash disease. Option A Ranikhet, options B CRD, option C fowl typhoid, options D rinderpest. The right answer is option A, that is Ranikhet. Hemorrhage at the tips of proventricular gland seen in case of Ranikhet disease, while hemorrhage at the junction of proventriculus and gizzard seen in case of IBD, that is infectious bursal disease. In case of that CRD, cheese-like inflammatory materials deposited in ear sac. And if we see that foul typhoid, then we found that liver is friable and swollen and has a dark red or almost black in color, and its surface has a characteristic coppery bronze stain. And if we see that rinderpest, that zebra marking or tiger stripings is seen in case of large intestine, especially cecums, and also sometimes continue to rectums up to. Question number 16. If a thrombus is attached to the entire endothelial circumference of vessels, it is known as option A, circumference thrombus, options B, mural thrombus, option C, occluding thrombus, options D, lateral thrombus. The right answer is option C, that is occluding a thrombus. If a thrombus is attached to that entire endothelial circumference of vessels and completely obstruct the flow of that blood through those vessels, such type of thrombus is known as occluding thrombus. Thrombus is nothing, it's just a clot, platelet clotting, which is formed inside that blood vessels. Okay, tissue that due to this thrombus is known as infractions because of lack of blood supply to the tissue. And if you see that mural thrombus is nothing, is just an organized blood clot which is located on a heart, which is that attached to the wall of the blood vessels or that endocardium of heart or a wall of a ventricles. Such thrombus is known as mural thrombus. Okay. Question number 17. Uh, Dash is a tick-borne disease. Option A, avian tuberculosis. Options B, spirochetosis. Option C, cholesepticemia. Options D, fowl cholera. The right answer is option B, that is spirochetosis. Avian spirochetosis is an acute bacterial infections which is transmitted by tick to the wide range of bird, and the causative organism of that avian spirochetosis is Borrelia anserina, that is spirochetes, and the most common vector that transmit this avian spirochetosis is Argus persicus, that is a cosmopolitan fowl tick. Okay. Questions number 18. Granulocytes are formed in options A, bone marrow, options B, lymph node, option C, spleen, options D, liver. The right answer is option A, that is bone marrow. Both granulocytes and agranulocytes cells are formed in bone marrow. These granulocyte cells include eosinophils, basophils, neutrophils, while agranulocytes includes monocytes, lymphocytes, etc. Questions number 19. Which is nucleated cells of erythrocytic series? Options A, rubricides. Options B, metarubricides. Option C, reticulocytes. Option D, normoblast. The right answer is option A, that is rubricides. Erythrocytic series is a succession of that morphologically distinguishable cells that are stages in erythrocytes development. In order of maturity, the pro-erythroblast and then lead to that basophilic erythroblast and then polychromatophilic erythroblast and then orthochromatic erythroblast and reticulocytes and then erythrocytes. Okay. Pro-erythroblast or rubriblast or pro-normoblast is that earliest cells of erythrocyte series which is arised from that colony forming unit, that is erythroid cells, and which give rise to basophilic erythroblast. Okay. Note, there's a note that nucleated cells of erythrocytic series, that is that rubricides and rubriblast and prorubricides These are the cells which only contain nucleus inside that cytoplasms, while after that after other stages of that cells of that erythrocytic series are non-nucleated cells, which is include that reticulocytes, metarubidocytes, normoblasts, extra. Okay. Questions number 20. Anemia resulting from the displacement of a bone marrow by abnormal cells is called options A. Pernicious anemia. Options B. Myelocytic anemia. Options C. Depression's anemia. Options D. Aplastic anemia. The right answer is option B, that is myelophysis anemia. Anemia, which is resulting from that displacement of a bone marrow by that abnormal cells, is called myelophysis anemia, while pernicious anemia is that anemia which is occurs due to the deficiency of vitamin B12, which lead to the failure of that maturation of RBC. While aplastic anemia is a condition where that the body stops producing enough new red blood cells due to the defect in bone marrow. Okay. Question number 21. Myeloids ratio is to erythroids ratio is increased in option A, erythrocytic hypoplasia, options B, erythrocytic hyperplasia, option C, leukopenia, options D, leukocytosis. The right answer is option D, that is leukocytosis. Myeloids is to erythroids ratio is increased in case of leukocytosis, since myeloids cells leads to give productions of leukocytes, while erythroids leads to productions of erythrocytes. And leukopenia is a conditions when there's a decrease in number of leukocytes, while leukocytosis is a conditions where there's an increase in a number of leukocytes. And erythrocytic hypoplasia is a decrease in a number of erythrocytes, while erythrocytic hyperplasia is an increase in a number of erythrocytes. Okay. Question number 22. The cellular reactions in transplant rejections comprise options A, T cells, options B, that is B cells, option C, that is T and B cells, option G, T cells and macrophages. The right answer is option D, that is T cells and macrophages. The cellular reactions in transplant rejections comprise T cells and macrophages. The ability of that recipient's T cells to recognize donor-derived antigens, called that allorecognitions, that initiates allograft rejections. Once that recipient's T cells become activated, they undergo clonal expansions, differentiate into effector cells, and migrate into the graft, where they promote tissue destructions. Okay. Questions number 23. Surface marker on killer T cells are which of the following? Options A, CD2, options B, CD3, options C, CD8, options D, CD5. The right answer is option C, that is CD8. Okay, the surface marker which is present on helper T cells is CD4, while the surface marker which is present on a killer or cytotoxic T cells is CD8. Okay. Questions number 24. Basophilic erythrocytic cytoplasm is typically seen in options A, hypochromasia, options B, polychromasia, option C, hyperchromasia, options D, oligochromasia. The right answer is options B, that is polychromasia. Basophilic erythrocytic cytoplasm is typically seen in polychromasia. This polychromasia occurs on a lab test when that some of that red blood cells show up as bluish gray when they are stained with a particular type of dye, while hypochromasia means that the red blood cells have less color than normal when examined under microscope. This usually occur when there is not enough of pigment that carry hemoglobin in RBC. Okay. While hyperchromasia, that is conditions, hyperchromasia conditions highly suggest the malignancy. Okay. Questions number 25. Normal or below normal leukocytes count occurs in options A, leukemic leukemias, options B, subleukemic leukemias, option C, leukocytosis, options D, leukemic leukemias. The right answer is options B, that is subleukemic leukemias. Normals or below normals leukocytes counts occurs in subleukemic leukemias, while in leukocytosis and leukemic leukemias, leukocytes counts increases. Questions number 26. An elliptical erythrocytes is called options A, spherocytes, options B, lactocytes, option C, ovalocytes, options D, myelocytes. The right answer is options C, that is ovelocytes. Elliptical shaped erythrocytes is called ovelocytes, while spherical erythrocytes is called spherocytes. Flat erythrocytes is called leptocytes, while myelocytes are the precursor of that neutrophils. That's the largest class of white blood cells. Okay. Questions number 27. Which is related with increased erythrocytes count? Options A, erythrocytosis. Options B, reticulocytosis. Option C, poikilocytosis. Options D, anisocytosis. The right answer is option A, that is erythrocytosis. Erythrocytosis is just increased erythrocytes count, while reticulocytosis is that elevations in a number of reticulocytes. Reticulocytes is nothing, it's just a young red blood cells in blood, a sign of unusually rapid red blood cells productions. The number of normally the number of reticulocytes is less than 1% of the total number of red blood cells, and if that increases greater than 1%, that condition is known as reticulocytosis. Okay. Poikilocytosis, that increase in that abnormal red blood cells of any shape that makes up to 10% or more of the total populations. Poikilocytes can be flat, elongated, teardrop shapes, crescent shapes, sickle shapes, or having thorns-like projections extra. Well, I know anisocytosis is a medical term for having red blood cells that are unequal in size. Okay. Questions number 28. Small sphericals concentric nuclear remnant in young erythrocytes is called options A, ER bodies, options B, hinge bodies, option C, Hovell Jolly bodies, options D, none. The right answer is option C, that is Hovell's Jolly bodies. Hovell's Jolly bodies are the little fragments of that red cell's nucleus, which is commonly seen in case of that splenectomy, while hinge bodies are nothing, it's a denatured globin chain, which is mainly seen when there is a glucose 6-phosphate dehydrogenase enzymes deficiency occurs, and when there is no enough this enzymes, the bond between that hemi and globins is broke, and that hemi just recycles while that globin chain become denatured, and that forming a little ball like structure that stick to that inside of the red cells membrane, and this is known as hinge bodies. Okay. Questions number 29. Which cytokines are produced by activated T cells? Options A, interleukin 2, options B, interleukin 3, option C, interleukin 4, option D, all. The right answer is option D, that is all. All cytokines all are produced by activated T cells. We see that T cells differentiations and role of cytokines. Then T cells are actually formed in bone marrow, and that this immature T cells migrates to the thymus. After that thymus selections, the T cells differentiated into two types of cells, that is CD4 helper T cells, which is able to recognize peptide that's bound to that MSC2, and then CD8 cytotoxic T cells, which is able to recognize peptide that bound to MSC first. Okay. When antigens presenting cells, that is dendritic cells, holding a peptide sequence of class second MSC molecules, that activated helper T cells get activated, and this activated helper T cells on return produce large number of interleukins, which in turn produce large number of activated T cells. And this activated T cells secrete cytokines that also acts on a bone marrow to increase the productions of monocytes too. Okay. Question number 30. Most appropriate term for the messenger molecules of the immune system is options A, lymphokine, options B, monokines, option C, cytokines, options D, none. The right answer is option C, that is cytokine. Messengers molecules of the immune system is cytokines, while that lymphokines are the cytokines which is mainly produced by lymphocytes, while monokines are the cytokines which is produced by monocytes. Okay.